Department of Biomedical Engineering, and I am going to teach about the blood cells and type of blood cells, their functions and structures. So first of all, I want to tell you about the blood cells. What is the blood? Blood is a connective tissue. It's present in our body, and blood main function is to be transport oxygen, nutrient to the all over the body. So blood is a connective tissue and group of cells called as a tissue. Now we talk about the type of the blood cells. So as we know about that, we have three types of blood cells. First is erythrocyte, same another name is for that RBC, red blood cells. Second one is leukocyte, WBC, I mean white blood cells, platelet as a thrombocytes. So RBC produced by bone marrow, and after the maturation it will reach in the circulation, and RBC main function is to transport oxygen, and oxygen need to reach all over the body because our body requires oxygen for all the living cells. So RBC, normal morphology, if we talk about the RBC look like that biconcave, and their center having the rich amount of iron and globulins, that's combinedly we are saying hemoglobin, that's provided to RBC in a red in color. RBC does not have any nucleus. RBC does not have any nucleus. Their cytoplasm having only hemoglobin that give him red in color. In the same side, another one, leukocyte, white blood cells. White blood cells is colorless cells we cannot see with the naked eye or in ordinary microscope without staining. So before seeing the WBC cells, we need to go for a staining technique. Example like Leishman stains, so that stain can provide to the nucleus separate color, cytoplasm separate color, and granules separate colors. As a WBC cells having two types mainly. One is granulocytes and agranulocyte. So granulocyte and agranulocyte. Again, granulocyte having two types. One will be maybe fine granules, and coarse granules. What does mean by fine granules? Fine granules is very minute kinds of granules that will be visible in very tiny, and coarse granules will be look as a something like that, and fine granules will look like that. So some cells in the differential, the fine granules category cells are coming neutrophil, so neutrophil structure it will see that will be their nucleus will be in the lobes. The lobe will be 3 to 5 3 to 5 lobes will be present in neutrophil, and granules will be very small in this cytoplasm. So this is nucleus or lobes. This is fine granules, and there's a cell plasma membrane of cells. Sometimes neutrophil, also called as polymorph. Neutrophil is the first line defense mechanism which fight against the all kinds of pathogens. So especially any acute kinds of infection happen, first neutrophil will be attacked and their number will be increased on the blood circulations. So WBC, the first cell which is appear in the defense, this is the neutrophil. They are having fine granules with 3 to 5 lobes and sometimes having the 7 lobes. That's depend upon the disease, infections and kinds of things. Sometimes we have 7 lobes in the when WBC is too mature and up to their die. So their lifespan is 3 to 4 to 7 days, and after that neutrophil WBC will be dead. Next is second one, coarse granules. Coarse granules having 3 cells. One is basophils. Sorry, 2 cells. One is basophils. Basophils having coarse granules, and that granules will be visible and their nucleus will be less visible. So their lobe itself is not at all much visible. So basophil contribution in the blood cells is just 0.2 to 5% of the total WBC cells. Neutrophil, their number is 40 to 71% of the total WBC cells. Their contribution, basophils especially increase in the some condition like burning case, then like insect bites, like snakes and all. So more allergy condition, hyperallergy conditions, that cells number will be increased, and that condition is called as basophilia. Once basophil number is less than 0.2%, we can say basopenia. Similarly, the neutrophil number is higher than 70 or sometimes 65, we consider as a neutrophilia. When neutrophil number is less than the 40, we can say neutropenia. What's the meaning of that? Increasing number of neutrophil, we can say neutrophilia, and decreased number of neutrophil, we can say neutropenia. So basophils, structurally they are having the coarse granules, that's entirely different from the fine granules. Fine granules, it's a very small tiny granules present there, where the basophil having the coarse granules. Another one says is eosinophil. In the granulocyte, another says is eosinophil. Eosinophil is mostly presenting bilobe. Bilobe means they have their nucleus will be in the divided in 2 lobes, and that lobes will be inside of this cytoplasm, and they are also having the coarse granules. eosinophil always appear in higher than their normal range. The condition is more allergic conditions. Allergic condition, so their contribution in the WBC is 1 to 6% only. So once eosinophil number is higher than 6, we can say eosinophilia. Once their number is less than 1, we can say eosinopenia. So both condition is dangerous. So when we have any kinds of allergy, for example, we have any parasitic infections like any farmer or any villagers, there have suppose any kinds of parasitic infections. So parasite is always allergic for the human beings, and then our eosinophils will be try to defense with that nematodes or worms or amoeba, and their number will be increases. So once their number will be increasing, they have granules. That granules is toxic for the other part of the body, and body will get allergy. So all kinds of allergic reaction, mostly eosinophil number will be increased. So eosinophilia mostly will be seen in the parasitic infections, common colds, bronchial asthma kinds of diseases. So that's a eosinophil. Another one, cells is a granulocyte. In WBC series, a granulocytes is lymphocyte. Their nucleus will be 1/3 of the cells. 1/3 of the cells, and cytoplasm. This is the cytoplasm will be less, and nucleus will be not in the low, but it will be cover almost 80% of the cells. So lymphocyte will be two figure maybe can be visible inside of peripheral blood smear. So what of that? So maybe one is the large lymphocyte, and a small lymphocyte. A small lymphocyte, we cannot find the cytoplasm. The whole cells will be covered with their nucleus, and cytoplasm will be not at all visible. So that lymphocyte called as a small lymphocyte. A small lymphocyte. So this contribution in the WBC is 25 to 35%. Once their number is increased, we consider as a pathological condition. So what are the conditions? Mostly the number is higher than 35, we can say lymphocytosis. Once number is less than 25, we can say lymphocytopenia. So these cells can be decreased in the some bacterial infections. For example, in the typhus fever, which is causative organism Salmonella typhi and paratyphi. Sometimes it will be increased. So mostly these cells can be helped to prevent defense mechanism. It's reached in little late. That's why this cell is always increased in mostly the chronic diseases like tuberculosis and some other of the diseases, and it's increased in viral infections also. Once neutrophil mostly popular for bacteriological infections, but lymphocyte will be bacteriological as well as the viral infections. So next cell in agranulocyte is monocyte. Monocyte contribution in our body is 1 to 8 percentage, and their nucleus will be is visible as a horseshoe shaped or kidney shaped, or we can say bean shaped. So monocyte look like horseshoe shaped or horseshoe shaped. So this part is cytoplasm, this is their nucleus. So mostly monocyte will be appear in our body the many conditions, because that mostly appear in phagocytosis process. Any foreign particle microbes trying to invade in our body, monocyte is the different form in the our body that will be try to engulf that microbes or cells and try to kill on that. So that monocyte functioning as a phagocytosis process. So this is the scenario of a type of WBC cells. Third type of blood cells is platelets. Platelets also we can say thrombocytes. So their number in our body is in the log 1.5 log to 5 log. So platelet once increase in the number, we can say thrombocytosis. Once the platelet number is decreased from the normal range less than 1.5 log per cubic millimeter, then we are saying thrombocytopenia. So platelet always it's in the form of dot form. It's look like that the coarse granules or dots. So what's the major work for that? The major work for the platelet, any kinds of injury happen, the vessels injury or anywhere blood is coming out, then platelet can reach there immediately trying to shield that veins or arteries. With their supporting all the clotting factor, they try to seal that area somehow and bleeding disorder will be stopped. So mostly it's functioning as a sealer, and they are repairing the blood vessels with sealing with there is some types of enzyme. Platelet also decrease in some diseases. As per we know that some disease is very popular nowadays, like dengue fever, chikungunya conditions, platelet number is decreases. Once platelet number is decreases, rash kinds of things happen in our body, that will be very allergic and body will be irritating, itching kinds of things happen. So platelet is also a very important blood cells present in our body. Now things is how we can see these cells. What's the way to find out how we can find out all the blood cells? As we said, that's we can find out through the, like we have to go for the red blood cells, what's the number present in our body. We have to check through the total RBC count. So how will do that? So we can do that RBC count through the either CBC method, the advanced method, or traditional method is we can use the Newbar counting chamber, and by help of the one fluid is there called as RBC diluting fluid. So we can use the RBC diluting fluid, and that RBC diluting fluid, what is the property is that can be remove remaining two cells like leukocyte and thrombocyte, they can remove, and only RBC will be present there. So we can load in Newbar counting chamber, and we can focus under the high power field, and we can count in the Newbar chamber. So Newbar chambers mostly it's look like that in a square, and a square all the corners, the center part will be a square having the 25 squares. So these four corners plus center we can count the RBC, and finally we can calculate by using the formula like dilution factor, the depth of the Newbar counting chamber, and all those things, and finally we can get the RBC value. So RBC is mostly the highest number compare than these two cells. Another thing is morphological structure of RBC. RBC once decrease in our body, we can say that the same person or subject is suffering from the anemia. So anemia having several variety like vitamin B12 deficiency anemia, thalassemia, iron deficiency anemia. These are some of the example of anemia which is related to red blood cells deficiency. So red blood cells, their morphology also can be changes during the diseases. So RBC morphology, sometimes it will be like suppose their shape will be like sickling, that condition we are saying sickle cell anemia. Sometimes that RBC will be created. RBC will be created. Sometimes RBC will be like the mouth. So we are traditional name that mouth cells. Their central pillar will be visible mode and mouth. So what's the mean of that? When hemoglobin level is too low, then RBC morphology will be automatically changes in there, and we can write the comment on there. RBC, what's the morphology? Either RBC shape is increases or decreases. If increase means from the normal range, we can say macrocytic, MACR, macrocytic. Once their size will be decreased from the normal shape, we can say microcytic, MICR or microcytic anemia. So those things can be writing through the one thing that sometimes doctor asking PBS. PBS is peripheral blood smear comment. So in comment, what we have to write? We have to write the morphology of the cells, and we have to correlate their total number of the RBC. So suppose we are writing the comment, so we have to take care. Suppose microcytic and less number of RBC is there, and we are writing the comment, so we have to take care about that. So that's the totally related to the anemia and thalassemia due to the hemoglobin and RBC deficiency. Sometimes the bleeding, the disorder will happen even though RBC number will be decreases. When sometimes the burn cases, all the body fluid will be dry and cell suspension will be high. It's look RBC number more, but in the burn cases, then Second one is the WBC, like leukocyte. So how to count that? So their process is that we can count total leukocyte count. Through that we have to use WBC diluting fluid. That fluid, what that will do, they will remove remaining two cells like RBC and thrombocyte that can be removed, and only WBC cells will be present over there. So that's the main function of the WBC diluting fluid, that we can load in the newer counting chamber. Like suppose this is newer counting chamber, there the four corner we can utilize the 16 square for counting of WBC cells. That can be, we can go through that this way directions, and we can count the cells. And total all the 416 squares, I mean 64 square we have to count, and we have to total number 8, and that using the formula we can calculate the total number of the WBC cells. The total number of WBC cells is 4000 to 11,000 is the normal range present in human body. So range will be 4000 to 4K to 11. 4,000 to 11,000. Now, question is, how we can write the peripheral blood smear comment on WBC cells? Just imagine about that. Here the WBC cells is higher than 11,000. That condition, but we have to look at in the PBS their differential count also. So differential, suppose the neutrophil is higher number, more than 70%, then what would be comment? Comment will be, suppose neutrophil is the higher number, more than 75%, and WBC total count is more than 11,000, like 15 or 20 something, then what would be the comment? Comment will be leukocytic neutrophilia, leukocytosis, neutrophilic leukocytosis we need to mention them. Or if decreased number of total WBC cells less than 4,000 and neutrophil is also less than 40%, then what will be the comment on PBS? PBS comment would be neutropenic leukocytopenia. The similar way, suppose eosinophil number is higher than the normal range, and there WBC cell is higher, then we have to write eosinophilic leukocytosis or eosinopenia leukocytopenia, eosinopenic leukocytopenia. So this is the way to writing the PBS comment on the WBC. Same with the basophils, same with the lymphocyte, we have to write lymphocytopenia or lymphocytosis to correlate with the total number of WBC cells. So okay, it's fine. Next cell is thrombocytes, I mean platelets. So platelet will be always can be count the same way, or we can directly count through the peripheral blood smears also. Suppose their higher number is there, we can find out more number of platelet present in peripheral blood smears. That peripheral smears, how I will prepare? Starting the practical way, we need to prepare first slide, and we have to take a drop of blood. That blood can be, we can prepare the smear, and it should be look like that, the tongue separate. It's not more thick, it's not more thin. So we have to take care about that, and we can then go for the staining technique like Lisman staining technique will be the very good for the peripheral smear, peripheral smears. So we can stain with the Lisman stain, and we can wash properly, dry and focus under microscope. Then we can only see this differential count, and platelet will be visible in the dot form always. Sometimes platelet will be joined together, two platelet or more than two platelet will be joined together. That platelet we are saying giant platelet. Sometimes the more number of platelet will be together, we are saying accumulation of the platelet cells. So these are the types of blood cells which we can see in the peripheral blood smear, and we can help to the doctor to writing the comments. So in this word I am going to finish this session. Thank you very much.